My name is Gerry. I'm from the Melrose Sauk Centre area of the rural Stearns County. I got involved in the mental health programs that were there about 7 years ago when I was at a meeting at a church in Melrose. One of the fellows who was suffering from schizophrenia, after we had gone through a discussion for about an hour and a half, asked me if I would be involved in the mental health group and helping them to provide more information to the rural community. We set up some small groups that we meet even today with every week for about two and a half hours. To promote awareness, we are getting ourselves into the local community, into the churches with speeches, with talks. Some of the people from our group have formed almost a little speakers bureau, and we will even go to the University of St. John, to Hope Center in St. Cloud, to the various churches around, talking about mental illness and what can they do about it. We had just set up a continuing education program for the first time that we'll be having this fall, and we are expecting about 75 people that will be attending to get continuing education credits in the area of mental health and in mental wellness. To expand the awareness, we've also had a photographer who was very interested in a friend of hers who had mental health issues. She put together a photography exhibit that we now have at the gallery across from the Paramount Theater in St. Cloud, running from the 1st of May till the end of May. We have worked with St. John's University. We have gotten some of the university professors who made a presentation to the leadership groups at the University of St. John's, and as a result, they had one of their professors who was teaching classes on mental health and religion. One of the students who was working on their master's degree actually came out and, as part of their continuing education, worked with our group in setting up new ways that we can take and expand the awareness out into our community. We have plans to continue this, expanding into more groups, expanding into more churches. Where this leads in the future, we're not exactly sure. One of the other things that we did, we went to the Centricare Board of Directors meeting for several years and made presentations on the lack of mental health programs and services for rural Stearns County and Todd County. As a result, along with many other factors, with the Obamacare program and everything, Centricare has now decided to make mental health as their #2 priority to focus on for this next 5 years.